NBC News anchor Brian Williams is actually making some news himself, undergoing knee replacement therapy. We are Skyping with Dr. Rajeev Pandarinath to discuss what's becoming a very requested procedure. Doctor, I guess you're hearing from a lot of patients asking for knee replacements. Why is that?
Well, as our population ages, arthritis is becoming a more and more common problem. People are becoming increasingly active, even into the golden years, and they want to be able to walk around better.
So it's the baby boomers getting older. Is it the surgery getting better too?
Well, that's hard to measure because when we talk about knee replacement surgery, we're not talking about how somebody does 1 or 2 years from now, but actually 15 or 20 years from now. So we're constantly coming out with new versions of knee replacements that are estimated to be better each year. But all of the data that we use to quantify how well we're doing is based on the knee replacements that we were doing 15 and 20 years ago.
Well, I mean, some of the stats are remarkable. I think they said there were 378,000 in 2003. Now there was 700,000 last year. Is that, I mean, all these people were injured in high school sports or college sports or, as they got older? What's causing all these?
No, not at all. Actually, most people who have knee arthritis never actually had an injury. Arthritis really comes as a combination of one of three things. Part of it is related to your genetics. So people may have a genetic susceptibility to wear out their cartilage faster than others. Another one comes from trauma, which would be those people with injuries. And lastly, it would be from just age.
Brian Williams, the news anchor, said he had a bad football injury when he was in high school, and it finally got to the point where it was keeping him up nights. Is that something you hear, whether it's an injury or arthritis or whether that I think his words were something along the lines of anything had to be better than what he was suffering now.
Right. Well, arthritis oftentimes starts out as kind of a nuisance, a pain that bothers you when you are first getting up out of a chair or getting out of bed. But over time, as the arthritis gets worse, as the cartilage lessens in your knee, the knee pain becomes more constant. And it's exactly how he describes it. Sometimes people really have a hard time getting to bed at night because their knee's aching from the day, and it can be life-altering.
So at what point do they call you up?
Well, at all stages. So what we do as orthopedic surgeons is not only the surgery, but also the preoperative counseling. So people really need to understand what they're in for so they can have their expectations met.
Okay, so what are they in for then?
Well, typically a knee replacement surgery takes about an hour and a half to 2 hours, and most people are in the hospital for at least 2 or 3 days and sometimes longer. There's not a very high rate of complications, but most people are off of work for about 3 weeks to up to 2 or 3 months, depending on how physical their job is.
Is this a choice they make, or is it necessity?
It's a completely elective surgery, so it's partially a choice. I guess it depends on what you count pain as in terms of determining how you decide things. But certainly people tend to try to do a lot of non-operative things to get rid of their pain initially, and when those are failing is oftentimes when they consider a knee replacement surgery.
So you go in, and when they talk about knee replacement, I mean, you have a prop there. Show me what goes on.
So this is an example of a knee replacement here, and you can see in my hand I've got the femur or the thigh bone above and the tibia or shin bone below. And what we do in a knee replacement surgery is we actually cut off the surface of the joint and replace it with this metal surface above and below, and in between is sandwiched a piece of plastic, and it's a special polymer that's designed to resist wear and last for as long as possible.
I take it some rehab's involved here?
A key thing is to have a patient that's very motivated, because it requires physical therapy 2 to 3 times a week for the first couple of months so that the knee can get its motion back, so that the muscles regain their strength, and we have a good outcome.
Why is the recovery so long?
Well, in order to do the surgery, there's a lot of surgery that's involved. So we're cutting the bones, we're cementing in these pieces of metal and placing plastic in between. So it takes a lot out of people to have the surgery done.
What about weight issues? Does that factor in a lot?
It does. So maintaining a healthy weight is very important, both for the treatment of arthritis and also for making the knee replacement last longer. The more you weigh, the faster your knee replacement will wear off.
So what's the one question? What is the one question you really suggest patients ask their doctor?
I would say they should ask you, have I tried everything? Anti-inflammatories for the knee, injection therapy such as cortisone injections. There's newer injections such as viscosupplementation, which involves injecting like a lubricant-like substance into the knee to help decrease the friction. There's bracing, and of course there's weight loss. I think patients should look at arthritis and think about it, and they should say, is this affecting my life to the point where I cannot do all the activities that I'd like to participate in? And if the answer is yes, and they've tried all these things, then really a knee replacement is something they should consider.